Great, thank you, yes. Good morning, Chair Burgess and the rest of the board members. We have discussed in the past that this surge that we are seeing from the Delta variant is being fueled by people that are not vaccinated. You are 13 times more likely to end up in the hospital with COVID if you're unvaccinated. That's based on our own data. We have seen a big increase in the first doses since the implementation of the employer-based vaccine mandates and the full FDA approval being given to Pfizer vaccine. This pandemic will last for years, and we expect there will be additional surges and variants. CCH is now preparing for a COVID-19 response for the next 5 to 10 years. So we do expect it to be around that period of time. Right now, I'd like to turn it over to Dr. Savelli. Dr. Savelli.
Thank you, Randy. Thank you, board members, for the opportunity to report. As a community, I want to give an update. We're seeing a big rise in demand for COVID testing. Contra Costa Health Services is working with the state to ensure that residents have access to quick, free, dependable testing in all the regions of the county. We've actually been setting records this past week for number of tests done per day countywide. The county-run tests take about 48 hours, and we've expanded some hours. The state-run site in San Pablo began offering expanded hours 2 days ago on the 5th. Starting today, the Antioch testing location began offering 7 days a week, 7 a.m. to 7 p.m. testing. And the Brentwood site will begin the same expanded hours on the 13th of September. So we're gonna expand even more, which is great. We're also working with our partners. We're asking John Muir, we're asking Kaiser, we're asking the community clinics to increase their testing capacity as well. Because we are adding more appointments, more scheduled appointments, we are taking walk-ins at the county sites, the 3 county testing sites, which are in Pleasant Hill, Richmond, and San Ramon, up to 11:30 in the morning. Before we were taking them until 2:30, but we've substituted more scheduled appointments for those. So we're taking the walk-ins until 11:30. I want to now shift gears a little bit just to talk about COVID, this long-standing pandemic and all of our response to it and all the things that we are recommending that our community members do. And I want to just give the analogy that living with COVID circulating in our community is like driving a car. So when you get in the car, you always put on your seatbelt. And with COVID, it's the same thing. You wear a mask, which is like wearing a seatbelt to keep yourself safer. Cars also have airbags, right? And so with COVID, we also social distance. That's like having an airbag, like another measure to protect yourself. And when we drive a car, we are sometimes getting low on gas or an electrical charge, and we have to charge or add more gas. And that's the same thing with our body and our immunity. Over time, sometimes our immunity runs a little low, and that's when we need a booster. And so that's the same thing, and we ask you all of these things to keep the entire community safer. A couple of updates on our healthcare guidance that we've been putting out. We've released a new youth sports and activities guidance to help young people and spectators stay safe when playing field sports and other extracurricular activities. The state has a guidance for sports in K through 12 schools, and our county guidance is not a legally binding health order, but it's expert advice for how to stay safest while participating in these activities that have so much value in our community. So in addition to what the state has in their K-12 school sports guidance, we've added recommendations for using face coverings, for vaccination, for COVID-19 testing, and also for transportation and hygiene practices. And our guidance applies to both school and non-school activities. We are strongly encouraging masks for all participants, coaches, staff, volunteers, spectators in outdoor sports. They are already required by our health orders in indoor sports. And then we're also recommending that participants, including children, staff, coaches, volunteers, get tested for COVID-19 regularly. It's the healthiest choice.